Around the world, obesity is becoming more common, leading many to suffer from its health consequences. We can't pinpoint a single cause of obesity. It's really a mix of genetic, environmental, psychological, and social factors. So, should we study how we can prevent children from becoming overweight? Or help adults lose weight? Or how we can change the commercial world to make healthier food more affordable? Or the design of towns and cities to make physical activity a greater part of our everyday lives? Whatever we choose to study means, by implication, choosing to study less of something else that would also be valuable. There's only so much research money and attention to go around, but we will make most progress if we concentrate our research attention on the questions that matter most. We engage members of the public, researchers, doctors, nurses, charities, and policymakers from across the UK and ask them to put forward questions that are currently unanswered or inadequately addressed in the existing literature and would have the most impact if answered by research. This is called a priority setting partnership, and we broadly follow the steps set out by the James Lind Alliance, a charity that offers a framework for collaboratively prioritizing research questions. The first step in this process involved an online survey to gather research questions that were top of mind among our respondents. We then grouped these together and excluded the questions that had already been answered or were out of scope. In a second online survey, participants were asked to rate the remaining questions in survey 1 in order of importance. From this, a short list of 30 questions was drawn up. In November 2020, we held a workshop for a subset of survey respondents and key stakeholders. From this meeting, a list of the top 10 research questions was agreed upon. And now we are pleased to share this list with you so that we can generate science that focuses on the questions that matter most. In no particular order, here is an abbreviated version of the top 10 questions. What improves weight loss? What helps keep lost weight off? What is the right mix of prevention and treatment policies? Do interventions to change the obesogenic environment affect the nation's weight? How can we prevent unhealthy weight gain in children? What could the food industry do to improve weight control? What is the impact of policy on the affordability of healthy diets? Do social and cultural factors affect weight, and should they shape weight loss strategies? Can we improve models to forecast the effect of weight change on long-term health? And what controls appetite and food intake, and how does our appetite regulatory system respond to weight change? These are big questions that won't be answered by one study alone. We expect, though, that by focusing sustained research attention on these questions, we can make progress in answering the questions that matter most to understanding weight and the problem of obesity. Just as important, we hope it will galvanize research funders to want to address these questions. Their commitment through commissioned calls and by favoring research that addresses these questions is going to be key to make faster progress in research so we can improve outcomes for us all. If you want to read more, please check out our website.